Hi, let's look at the anatomy of the heart and the blood flow through the heart. Okay, when looking at this diagram, first we need to decipher right and left. And it's not how you see it. This isn't your right, this isn't your left. It would be as if this was your own heart. So the right side is here, the left side is here. So that's your right, that's your left. All right, let's look at some of the external structures and vessels that we see, and then we can take a peek inside what we see there. All right, so let's just kind of go through these. Let's go through these numbers. I'm going to have to abbreviate some of these. But this vessel on the outside, this right here, is what we call our aorta. So this part's the aorta, and it leads into what we call the aortic arch. Okay, say aorta. This vessel on the outside here is what we call our superior vena cava. All right, this is our right side. So this vessel right here is what we call our pulmonary artery. Number 4, these two here is our pulmonary vein. 5 is pointing to, let's skip the inside, let's just, like I said, let's say to the outside. This vessel on the bottom of the heart is called our inferior, below, so inferior vena cava. All right, this, back to our aorta, blood's going to come out through the aortic arch and go down, and it's going to go down in this direction to the bottom part of the body. This is for 15 what we call our descending aorta. 10 are your pulmonary veins, and 9 are your pulmonary arteries. Okay, so these vessels are all on the outside of the heart. Now let's look at the inside of the heart. Things we need to note here. We have got 4 chambers. Okay, so these 2, 1, 2, represent the top chambers. These represent the bottom chambers. So, 1, 2, and then 3, 4 are your bottom chambers. These collect the blood from the outside of the body. So blood's going to trickle in here in this direction, and blood's going to come in here from the pulmonary veins into this section here. So this would be your right atrium, which is number 5. Number 11, which I'll just write here, would be your left atrium. Okay, atrium Latin for collecting, because this is going to collect the blood. Then we've got the vessels on the bottom, which are your pumping vessels. This is called your right ventricle. This one would be called your left ventricle. And they're called the pumping because these will pump blood out of the heart to the rest of the body or to the lungs, which we'll talk about in a second. So you've got the four chambers, 1, 2, 3, 4. We're also going to have 4 valves of the heart. Okay, I'll put them in, let's put them in yellow. Okay, so here's a valve right here. That's a valve, and that's a valve right there. Okay, and the purpose of these valves are so when the blood comes down in this direction, the blood doesn't go back up. Blood's not allowed to regurgitate. All right. On the right side, and these are given multiple names. Okay, this is called your right AV valve, or your tricuspid valve, because it has 3 cusps. On the left side right here, it's given the name left AV. AV stands for atrioventricular. This is your atrium ventricular, so it's your left AV valve. Also your bicuspid valve. It's got two cusps on the valve. I'll point these structures out when we dissect the heart. Or it's called the mitral valve. Because of the mitre hats priests used to wear, they said it looked like that. So these two valves are your AV valves, okay, right and left. You need to know both the names. Then you've got this valve here and this valve here. This valve separates your right ventricle from your pulmonary trunk. So probably something we should label here, your pulmonary trunk, which leads to your pulmonary arteries. So blood's going to leave the right ventricle, it go up this valve. It's shaped in a half moon shape, hence the name semilunar. So for number 7, we call that our pulmonary semilunar valve. All right, so that would be this right here. And then number 13 is this valve right here that separates the left ventricle and then the aorta. It's deep to the pulmonary trunk, so they showed it to you in the picture, but it's a lot harder to see when we're dissecting the heart. It's a lot deeper. In number 13, we would call that our aortic semilunar valve. Okay, so this kind of gives you just the anatomy of the heart, the inside, and some of the vessels on the outside. Let's go through the blood flow on our next slide to kind of show how these vessels participate in the flow of blood and how they move blood along. Okay, so I'm going to use blue. Now this represents deoxygenated blood. Okay, and the whole purpose of cardiac muscle, if we remember this from histology, is movement, helps circulate blood. Okay, so let's talk this superior vena cava. So blood's going to come back. Okay, blood's going to go through in this direction, all right, and in this direction. So this gets deoxygenated blood from the bottom of the body. This carries deoxygenated blood from the top of the body. All right. We're going to talk about later how blood becomes deoxygenated and all that. But for right now, this carries the blood that does not have oxygen in it. So again, represented in blue. All right. And it's going to come, so this could be our 1. You know, these two could be our 1, the vena cavas. Then it's going to come to 2. So for labeling it, it comes into 2. All right. So the first chamber in our heart is the excuse me, the right atrium. The blood travels then through 3, which is our right AV valve or our tricuspid valve, gets into this chamber, which is our right pumping chamber, which is the right ventricle. The right ventricle pumps or contracts, so all these muscles in here contract and blood shoots up 5, which is our pulmonary semilunar valve, goes through 6, pulmonary trunk, then 7 on both sides. Okay, 7 on both sides, that is your pulmonary arteries. The definition of an artery is arteries take blood away. So A for A, they take blood away from the heart. All right. So where is this blood going from your pulmonary arteries? Pulmonary, the word pulmonary, anytime you use it, is going to be your lungs. Okay, so we've got some, your left lung here, right lung here, excuse the drawing. So blood comes into the lungs. Okay, into our simple squamous cells. And in the lungs, what happens here is the gas or the blood undergoes a diffusion. All right, our waste products are carbon dioxide goes out and oxygen comes in. So now our blood is oxygenated. All right, that was the job of the lungs. And they come back in number 8, your pulmonary veins. The job of the pulmonary veins is to bring blood back to the heart, which is a vein. The significance about the pulmonary artery and veins is this. This pulmonary artery is the only artery in the body that carries deoxygenated blood. And these pulmonary veins are the only veins that carry oxygenated blood. Right? Every other artery in the body other than this has oxygen, and every other vein carries deoxygenated. So that's how these two are significant. So now that our blood has oxygen, now we've got oxygen-rich blood, brings it to number 9, our chamber up here, which is our left atrium. Goes through our left AV valve, or our mitral valve, or our bicuspid valve, one of those names, into our pumping chamber, which is our left ventricle. This pumps blood out this way through this valve, which is our aortic semilunar valve, to the aorta. All right, and there's branches off the aorta, so blood that has good oxygen, or blood that has oxygen in it, shoots out to the rest of the body in this direction and to the rest of the body in this direction. Just by looking, since these are my pumping chambers, just by looking at this, let's kind of look at things when we're looking at the heart. If you see the size of the muscle here and the size of the muscle here, okay, just by looking at it, you can see that the left is a lot bigger in size than the right. One of the main reasons is when this side pumps, it's pumping blood to the lungs, which are located right here and here. Okay, so this could be your lungs. When this side pumps, it's got to pump blood to the whole body. Okay, so because of this, we refer to our left side as our pulmonary side. I'm sorry, I said left side. I mean, we refer to our right side as our pulmonary side, and we refer to our left side as our systemic side. Because this shoots blood to the lungs, this shoots blood to the whole rest of the body. Okay, and that's a major reason why this side is a lot bigger when the muscle layer, because this is all cardiac muscle that makes up the heart. Okay, so that should wrap it up with the structures of inside and outside with some vessels and the blood flow through the heart. Thank you.